Adoption in healthcare AI is the single most important predictor of how organizations will be successful, and it's all a people game. Right now, everyone's focused on the technology, the model, look at my 2% better performance. The systems and organizations that get ahead are going to be focused on the people. People, not the technology. And the conversations today broadly are just totally backwards.
Today on the show, Halle and Michael speak with Justin Norden, the founder and CEO of Qualified Health.
Welcome to the Heart of Healthcare podcast.
Justin, welcome to the show, my friend. It's great to see you. I hope all has been well. Yeah, excited to jump in today. But before we do that, I think it would be remiss of me and Halle not to say congratulations on your most recent funding round. And I had the privilege of being your sidekick on this one. We raised $125 million in fresh funding, led by our friends at NEA, with participation from a number of great funds, including Transformation, Great Point Ventures, Menlo's Anthology Fund, Anthropic, our friends at Flair Capital and First Cressy, and of course, our good friends at Town Hall Ventures, among many others. Justin, congratulations.
Thank you. It's
awesome list of investors.
I'm super biased, but we believe we have the absolute best team behind us in healthcare to go figure some pretty daunting problems out.
Yeah, for sure. So, I personally know some of the backstory here. Justin, you invited me to join you on the journey back in November of 2023. I cannot believe it's only been 2.5 years since we had the privilege of incorporating and you launching Qualified Health. But for our listeners, Justin, can you tell us a bit about yourself and what you've been up to at Qualified Health?
Yes. So I'll go a little bit farther back because I think a little bit of my own background helps frame why Qualified Health, why we got started. But my whole journey, my whole life has been kind of trying to connect medicine, coming from a family of doctors, and computer science. I like to say I went to the grade school, high school, from Bill Gates and Microsoft. Was handed a laptop in middle school, and that was weird. Building my own computers, things like that. I always thought this was a hobby. Plan was always medicine. Computers were a hobby on the side. Ended up studying computer science in undergrad while doing the pre-med coursework, went out to England to do a master's in machine learning and genomics. And I was so excited, was accepted at Stanford for medical school. Oh my gosh, I'm going to see amazing technology at the bedside, changing how we deliver care. And you both are nodding because of course I did not see that. And it's even more frustrating at Stanford than anywhere else because you're in the heart of Silicon Valley and technology and seeing what is possible across the street, but not actually in the hospital for how we're delivering care. And my whole career has just been asking why, first being that annoying student, on rounds, why are we doing it this way? Why can't it be better? Look at these things we could do in technology. And then, taking detours farther and farther off the traditional clinical path. So stepped out to help launch our Stanford Center for Digital Health. Back in the time, was certainly reading Rock Health and everything you all were doing, candidly, as the trailblazers for this field. Ended up jumping over to Apple on the healthcare team, where I like to say, we pushed out push notifications to 1 billion phones, and we solved healthcare. No. But you could start to say, hey, if these were personalized, customized, could this actually change how kind of we're delivering care for patients? And the gap I saw at the time was until we could make sure we trust them, make sure these kind of notifications were performant, use AI systems, physicians wouldn't adopt it, patients wouldn't adopt it unless we could know that they were safe, know that they didn't fail in catastrophic ways. And so started a company literally called Trustworthy AI and quickly found out no one cared about this yet in healthcare. This was 2017, 2018, and people weren't ready to have the conversation we're about to have on AI and what's happening. And fortunately for us, there was an industry that did care, and that was the autonomous vehicle world, where, I'll argue still today, it's the epitome of where AI is being deployed in a life and death setting. And as we kind of had our methodology to understand the performance of these systems, ultimately sold that company to Waymo. So I had a brief detour understanding the autonomous vehicle landscape. Then I came over to, the other side of the table, was a partner, Michael, where we met at GSR Ventures doing early stage healthcare AI investing, joined faculty at Stanford, where I started teaching on digital health and AI in medicine. And fast forward to 2022 and ChatGPT launching, all of a sudden the world in healthcare started to care about AI. And I found myself going out to board meetings, leadership meetings for health systems, either wearing my VC hat or my faculty hat for what's coming next. Meanwhile, I was chatting with all these entrepreneurs, students for, look at my new idea for a company, look at my new widget, ambient documentation tool, et cetera, et cetera. And I was like, that's amazing. The tools are here. I also built that over the weekend already too. And like a widget doesn't make it a company, and it's not really what the health systems want to buy. And so after more conversations with health systems, actually around HIMSS 2023, a little over 3 years ago today, a handful of health systems came together and said, like, we see this wave coming, and how can we be more involved in shaping what comes next? How can we not just be handed our technology tools and have a part in working on them, work more collaboratively together as a health system? And that was really kind of some of the genesis from some of those people even pushing me to start Qualified Health, where could we be a true partner to the health systems, set up the infrastructure right to go all the way from the data, set up the tooling so that every single person at the health system could get access to these frontier models that are constantly changing their background, and then kind of be a partner to truly build end-to-end applications to drive value that, from my background before, we can monitor, evaluate, and govern to make sure that these are safe. And especially as you think about it, the prediction we made at the time, which actually, Michael, to your point, a lot of investors did not like as we started the company, was like, hey, that's too much. You can't do that. Like, you got to pick something. It's sharpest wedge wins. It's pick something narrow. That's how we train founders. That's how founders have been trained, going through something like, Y Combinator or something like that. And that wasn't what I thought would happen. It was, I think you're going to need a bigger partner. You're going to need to focus on partnering to the outcomes. You're going to need to focus on kind of really going deep with health systems, which is what I thought would work. And that's a little bit about what we're doing at Qualified today.
Yeah, what's really interesting for me, Justin, just, having been on this journey with you, has been, the emphasis around governance and safety and compliance, monitoring, and then I think most importantly, measurable ROI is something that we don't see a lot of AI solutions going into healthcare are focused on. So would you talk a little bit about that?
Yes. And building off of what we were talking about before, everyone just wants to race out and build something and get it into the hands of people. And I know that is the exciting part, but in healthcare, it's really not good enough, right? We have to know, how do we know the tool is working? Because the consequences are real. And how do we think about, before we deploy it, let's do our back tests on the data to make sure that this works? How do we run it in shadow on prospective data to make sure, hey, even though it worked in the past, it's working as intended going forward? How do we think about a staged rollout to a handful of users, then more users? These mechanics, again, some of which I saw in the autonomous vehicle world for how we test rigorously, again, non-deterministic systems now, in this case, interacting with patients. These steps are skipped. And candidly, it's too much effort to build the entire infrastructure to do that once. And so companies skip it. If you believe, however, that we're going to do this 100 times with a partner, if not 1,000 times, all of a sudden you think about the harness and the infrastructure to deploy these tools very, very differently. And so all the way to that final piece, which is how do we measure, again, I think about two scoreboards in my head, measure to the CFO that these tools are actually changing margin for the hospital and delivering return back, as well as the chief medical officer, chief quality officer, that we are actually improving metrics that we care about. And unless you're measuring end to end, interesting things happen of everyone kind of claiming, the sum of all the tools deployed at a health system is bigger than the revenue of the whole health system combined. And you've been to investors and you've seen decks like this. ROI numbers are candidly fantastical on some of these pieces. And so we find when we can partner kind of with the CFO, the CMO, candidly the C-suite of a health system and say, hey, we're on this journey together, we win when you win. We want to go deep on this. That's where we can have some of the best relationships and be the most productive.
Justin, fascinating stuff here. I'm hoping we can just rewind a minute and you can explain to me the product like I'm 12.
So the challenging part, Halle, is there are many products, but I'll go one by one.
Okay.
I'll start with the highest level, with the product that our company delivers on together. It is the scoreboard, right? How are we actually delivering value to the CFO, changing care outcomes for the CMO, and candidly upskilling an entire workforce to get access to these tools and start to train into how to use AI? That is at the highest level. This is our target, and this is how we're partnering with health systems. What does that mean now super tactically? We set up the data infrastructure once. How do we get access to not only EHR data, claims data, other sources, so that a single point can now build numerous AI workflows from that single data connection? The way I'll describe the workflows that we build, and this was a little bit of my madness as an investor beforehand, which is many healthcare workflows could be described as such. Connect to that structured and unstructured data, follow a set of rules written in natural language. That could be clinical guidelines. We can talk about our work there. Payer guidelines, how do we make sure we're getting paid for that care? Or internal hospital operations. Patient has XYZ, go to floor A versus floor B. And then source the exact piece of data, why the rule is followed, and then taking an action or letting a human take an action based on that. Those building blocks and components are what we focus on Qualified Health, which is why we talk about it as infrastructure. Those building blocks allow us to build clinical use cases, administrative use cases, externally and internally facing to the system. So we have use cases around care guidelines in cardiology. We did at least a case study earlier this year with Anthropic and University of Texas to kind of do population health in heart failure management, to find actually where there are misses in quality of care for managing patients on certain medications, or even bringing patients in who might need life-saving procedures to the system, right? Again, same as that format: structured and unstructured data, follow a set of rules, take an action. We do work in the revenue cycle management space on utilization review. Again, same format. We do quality chart abstraction, same format. All of these things are kind of use cases that we run kind of end to end for our partners. The final piece that we do, like the workforce, is something, and education, which I know you're teaching as well on this topic, is something kind of we care about deeply. And how do we get the entire workforce safe access to these frontier models where they can kind of bring it and combine it with patient data? And so we also get every single person at the health system access to these tools so that they aren't leaking out information publicly. There's a single interface where people can go to for training, internal changes, and then the ability for the system to really track and understand what's happening to make sure that people are using AI as intended. And then the final piece is those builder tools, right, of how we build those end-to-end workflows and kind of building blocks about how we get access to the data and take an action, we also provide to our partners so that they can build as well. And so I have gotten that question before of like, hey, what is it? What is it that you do?
Well,
And we do a lot.
Is there an analogy for this product that exists in like another industry?
So one I heard recently was, wait, you guys, the final piece I would say is we are also putting people side to side with health systems, right, to actually make sure that these things are being deployed as intended and help build. And the reason I say that is one analogy that came out is you guys sound like Palantir with a heart for healthcare. And I would say Palantir is the company actually that, candidly, essentially the only company that comes up as we're talking with kind of the C-suites of systems of, hey, we want to work on many things together. And candidly, when a system comes and says, hey, could you do this one thing? We say no. Like we don't think that's the right way to partner. It's not the right way for our model. And we can run much, much farther with systems that run. And so that's one of the closer ones that I think about.
I mean, it really is an operating system, right, for AI inside these hospitals and health systems. I mean, it feels like that's sort of the way I've thought about it, Justin. Maybe it's a little too limited in that paradigm, but that's sort of a shorthand I've mentally always thought about when you and I have discussed the company over many years. Let me ask about health systems just for a second, because one of the things that Halle and I have the privilege of sitting in investor conversations, board meetings, et cetera, is what are some of the biggest mistakes these health systems are making right now in evaluating these AI vendors? Like, if you were advising them, what are some of the, what are the one or two big mistakes they're making?
Well, I'll answer it slightly differently. Like, this is such a unique moment in time for technology and what is happening. And, living in Silicon Valley, I think half of my brain is focused on what the frontier labs are doing and friends are doing there. And then half is focused on foot in the door at health systems and understanding what's happening. And the reason I start there for your question is, depending on what you believe the impact of this technology could be this year for your system, next year, the year after that, you make very different choices on how much, as a leadership team in a health system, to focus on AI. So to me, the biggest mistake in kind of evaluating thinking about these systems is this incrementalism, or, hey, this is just an innovation thing approach, which is, hey, like, I don't know. And it's tough. And I understand how hard it is and how many people, these are big, complex systems. And for the history of healthcare, and I know it's maybe to the annoyance of all of us, like, thinking and being early in technology was the wrong answer. It has been, we saw the prior AI wave, Watson was going to change everything, right? We've been fooled multiple times by, the shiny objects in healthcare, and they just haven't had the return that we want. And so I understand it. And how healthcare has approached technology generally has been incrementalism, one thing at a time. The favorite word, pilot, healthcare is more pilots, than the airline industry. We've all heard these, tropes over and over again. But I think what is very interesting right now, at least to me, watching this technology kind of first as an investor and then playing with it myself and starting to build myself and then seeing what's possible today. If you're only doing things on the edges incrementally and not thinking about how do we start to really integrate it and run our system differently, you're just not going to catch up to a system that has leaned all the way in. And despite the fact that there is the competing thing, which is like, hey, well, what if we just wait a year, right? Like, the models will get better, we'll get, Anthropic's Mythos will come out, we'll get GPT-6 at some point, and then we'll use it. While it is true that we should all expect models and performance and systems to get better, our workforce won't adapt that fast. And the teams who are figuring out how you actually integrate it with your staff, with your data, set up your infrastructure to run, are going to be light years ahead, is my belief, than the ones who won't. And it's what are the things that won't change as models get better? Getting your data infrastructure correct won't change, right? Models are only going to be as good as how integrated with your systems, which is no easy task in healthcare. They're only going to be as good as your people understand how to use them and actually get their work done. If your people are rejecting AI tools because they don't feel brought along, if they're not learning how to use the tools, you're not going to get the value. And then the pockets of value for your health system actually aren't going to change either. And these are complex workflows with complex logic that do differ system to system, that do need to be understood deeply. And these are the things you have to make big efforts in today. They don't just magically happen, even though we have a better model coming out later. And so the mistake I see, and again, I have a super biased opinion on this as I'm spending time with leaders, but is people thinking about this as an incremental or an innovation project. It's something over there. And when I get time with health system CEOs, where we're spending more and more time today, this is your problem. And a lot of people don't want it to be. A lot of people, it's not their background. They don't come from this. And again, they got to be CEO because they didn't go first in technology, because if you did, it was probably the wrong move. But now it's a moment where the leadership is going to determine how fast this technology diffuses across your organization. And it's those organizations, I believe, that are going to be already starting to pull ahead this year as some of our work that we're running with them. And then it's just going to accelerate in 2027 and 2028.
Yeah. I mean, one of the problems, though, is that no one at a health system was ever fired for buying Epic or upgrading Epic, turning another Epic feature. I mean, we have this incumbent that has been, I'll say it, quite problematic for innovation. I don't know what you can say, but would love to kind of hear your thoughts on how founders can kind of navigate this like giant in the room. So say what you can there.
So almost every one of our health system partners is an Epic partner, and our goal is to work side by side and enhance Epic, enhance what they're doing. What I tell health systems is, hey, if we've built something and it's working together and Epic turns it on and you can get it through Epic, like, please use Epics. Like, don't make me redo work that you could have done elsewhere, right? There are plenty of problems to solve in healthcare, and it's a little bit of our model. I'm not tied to any one of these use cases that we deploy. I think it's very problematic when your entire business model is a single use case and then Epic turns it on. You're kind of stuck. Like, what do you do? And it becomes existential. Like, I think from our model from day one, it's like, look, we want to be partners and help you. If Epic has built the feature or it's kind of turning on next week, don't ask us to do that. Let's do something else. There are so many problems. And one thing I think about is this long tail of problems in healthcare, whereas I would love to be kind of a partner that helps health systems solve that. There's an example that's public with UT San Antonio, where they had a problem with delegated orders, which is kind of an audit requirement. And it's not a big use case, right? This is, a couple people working on this at the health system. So too small from our venture audience as a TAM. But because we have the building blocks and tooling to go solve this, a single one of our kind of 4 deployed product managers who work with them built this solution, turned it on, solved this problem, helped them with their audit. It made it into a Becker's blog post that they posted. And I didn't even know about it till it showed up in our Kudos Slack channel of, hey, we did this amazing thing and it came out. And I bring this up as an example because it is just one of the many things we can work on together if we get our infrastructure right, if we partner and figure out how to work together, and if we can go be hand in hand to solve problems now with some of the most amazing technology we've ever seen. And so when we can approach a partner like that with a system, it's yes, like we'll work well with Epic. Epic is the system of record, is ingrained with how health systems functioning. And you better, as a founder, come up with a model that is, symbiotic with that. And so this is how we've approached it, which is, again, different than the norm, but how we've been able to do that with our systems and partners.
What do you think would have to happen for a startup to displace Epic in the long run? Let's say like in 10 years.
Halle, these are dangerous topics to talk about, as you all know.
You heard it here.
One of the things you hear a lot from DC right now, and from, I think I kind of joke, it's all the health tech founders who are now, under Oz, running Medicare, Medicaid, and these other groups is longitudinal access to patient data. And you're starting to see this coming from, the administration on a patient first approach, their clear programs, access, pushing this through, as well as from, I think we're back to ONC now on, the FAQs around kind of data access and information blocking and things like this. And as you look at those kind of levers from DC on just easier and easier and easier access to data on the one hand, and you look at what's happening on the technology, that if it is on a screen and it is taking an action on a screen, this is in the core path for Anthropic, Google, and OpenAI to build computer use agents, understand everything on a screen as well as a human. These are two forces that start to make it hard to predict what healthcare could look like later. Where what if integration is truly as easy as a Stripe integration for building a new website? It'll be a different world, if those two things intersect. With that said, it's just with Seth and actually at Judy as well at the Scottsdale Institute a couple weeks ago now, and Seth is on it. he is as AI pilled as it comes, of kind of different people leading technology organizations, and they're leading all the way in. And so, Epic does have the best foundation and partnerships to run. And I really hope they do run fast at this, because they have access and can really up-level care across the country in an amazing way. So that's just a little bit about kind of where I see things going.
Justin, can we zero in on the clinician for a minute here? So we've been talking sort of at that system level. So you know better than we do that there's just enormous excitement around generative AI, and there's enormous anxiety. So where do you think skepticism from clinicians is most justified today?
The skepticism and pushback that I hear and really feel for is things are just kind of being thrown at the clinician, and it's on their license.
Yeah.
Right. Which is, what is the rigorous evaluation framework that the company is doing, or the government is doing, or the health system is doing, to make sure we've understood all the failure modes and understood this, and hand it to a clinician so they know exactly where to use the tool, where not to use the tool, how often it will fail. Like, it doesn't exist. And so it's all coming down to like, well, clinician, it's on your license. So if a tool says this, again, it's a little bit the Tesla autopilot example today of, hey, it's kind of hands-free driving, but you're still fully responsible. So you use it at your own risk. And I like that analogy, because like I have a Tesla. I use it. It's amazing. It makes it easier. I think it is helpful. And again, if you're tired or you're not in the perfect place, like I think it can make you safer, but you're still fully responsible. And so this is, I think, the conundrum that kind of clinicians are in right now, is they're being handed these tools, and they really are amazing. Again, there's so many different tools, the open evidences of the world, again, just ChatGPT, Anthropic, these base tools that are starting to lean more and more into healthcare. They're incredible of kind of information retrieval, getting things right, but ultimately it's just still fully on them. And so it will change. It's not coming soon. I think eventually we'll figure out kind of better regulatory frameworks and other pieces, so that it's not just fully on them to make the call and to kind of be holding the liability. But right now, that is, I think, a real skepticism that exists. But at the same time, like, these tools work, and these tools are adopting them, and clinicians are leaning in because it makes their lives better, and they think it improves their patient care. And I agree with them. I don't have a great answer to like, yes, you're still the one in charge. But again, that's where like this Tesla autopilot thing is, which is like, I'm still in charge when I use it. That's kind of on me if we get into an accident. But I also think it can make me better. And I think it's a helpful tool.
Yeah, I love that example, because I did want to touch upon Waymo, where you sold your company to and you spent some time. Waymo is increasingly recognized in our sector of healthcare, because there's now enough data to show that they're involved in fewer crashes and fewer deadly crashes. And also because of the way that they built their model, it's an example of like responsible, safe AI deployment, which is like a great analogy for us. But as we know, just like some clinicians are protesting AI, entire cities like New York City will not allow Waymo. Because you've been so deep in both Waymo and healthcare, I would hate to not get the chance to kind of hear your thoughts on the analogy between that and what we can learn from Waymo.
Okay, can I just say this is the first time in our podcast history we've been comparing Waymo and healthcare. I just love it. I mean, this is Justin, you have broken new ground for the heart of healthcare.
I still haven't met any physicians silly enough to work in the autonomous vehicle industry, but it'll happen more.
Do you not know Dr. Jonathan Slotkin? He wrote that article for the New York Times.
I have seen his article. I have seen his article.
Yeah. I will drop it in show notes. And I need to get him on the show. He's great.
No, I have read his article, and it really is amazing actually seeing people lean into this, because they are going first, right? The autonomous vehicle industry is going first, and we have a lot we can learn and borrow and copy from how they did things right, and also avoid for how they did things wrong. And so a handful of things I'll call out. One, how do we generate the evidence to show that these tools really are better, safer, cheaper, faster in healthcare? And we need to start that today.
Yeah.
Because the pushback is going to be immense. I think one of the other things that sometimes, we forget thinking about innovation and AI and all these topics is like AI is not popular in the US. And you can see that, right? As Waymo shows up in cities and it's real jobs on the line.
Yeah.
It's a change. It's confusing. Silicon Valley isn't viewed super popularly ever, and certainly not right now with these tools. The Silicon Valley has kind of gained power, and these organizations are growing and growing. And so, again, I was on a panel a few weeks ago, and that was reminded that I think it was a NBC voter poll, and AI is trending lower than ICE and just above the Iran war in kind of public sentiment. It is
lower than ICE. Wow.
And so when you see these pieses and then you start to realize what is going to come in healthcare, there is going to be immense pushback for kind of the adoption of these tools. There already is, but we haven't seen anything yet, is I guess maybe my prediction for what this looks like. And so how do we generate the data today to unequivocally show that these tools are better for our patients and for our providers? So that's on the one hand. I think the other piece that we can start to watch is what is the audit trail we start to actually provide for regulators? I think early on people talked about like, what is the driver's license test, for these autonomous vehicles? And it's kind of slowly progressed more and more testing for what that can look like. But then even before that, well, maybe we don't want to prevent these because we kind of believe maybe they're safer. At least let's be rigorous on having them report out their data. And at the minimum, let's talk about the crash data. Let's talk about the disengagements. Let's talk about these other, near misses. And we could be doing that now for healthcare AI. And actually credit to many of the folks at the FDA for kind of the direction they're going, which is if we do too much, we'll stop AI in its tracks. And we all think this can really improve what we're doing, but we don't have to do nothing. We can also encourage reporting what is working, what is not working. So if something isn't working, at least we can stop it and catch it before it does too much. But also if it is working, we can actually start to promote it and get ahead of it and start to kind of expand the use. And so I could go on and on and on the kind of the autonomous vehicle. I'll pause there for now, but those would just be a few of the highlights.
Yeah.
One last question, Justin. So tell us something about healthcare AI that you believe strongly today that most people still disagree with.
Adoption in healthcare AI is the single most important predictor of how organizations will be successful. And it's all a people game. Right now, everyone's focused on the technology, the model, look at my 2% better performance. The systems and organizations that get ahead are going to be focused on the people, not the technology. And the conversations today broadly are just totally backwards.
Inverted from that perspective.
It's totally inverted. And as much as like I'm a technologist and the technology is nothing short of amazing, it's going to be how organizations work on their workforce, upskill, lead, and lean into this. That is going to be the differentiator. Candidly, the technology will keep getting better on itself. And so it's just people as I think about kind of what this next phase is going to look like. And no one is talking about it that way.
Yeah. Awesome. Well, Justin, congratulations again on your round, on everything you're building at Qualified Health. Dare I say the Palantir for healthcare. We will continue to keep cheering you on, and thank you for your time today.
Thank you so much.
Thanks, Justin. Talk soon.